Bathing your baby. So to begin with, we recommend no use of any products. Again, for the first 4 weeks, let your baby's skin acclimatise and kind of toughen up a little bit before we start introducing extra products. If you choose to use a product when you're bathing your baby, just use one product, check that your baby's skin isn't reacting to that before you introduce something else. So plain water to start with. For bathing, remember that your baby has got a large surface area to body mass ratio, so they can lose heat quite quickly. You don't need to invest in a special baby bath. You could bath your baby in the kitchen sink, or a lovely way of bathing your baby is for one parent to have a co-bath. This might be something really lovely for your partner to do with baby, particularly if mum's breastfeeding. It's a lovely opportunity for your partner to have some skin-on-skin contact too. So for you to have the bath water not too hot, so probably cooler than you'd have your own bath, around 37 degrees Celsius or body temperature. And to pop your baby skin on skin against your chest. And again, the co-bathing can just help your baby feel more safe and reassured and enjoy the experience. If you're bathing your baby at a distance in a sink or a bath, remember the importance of mutual gaze, talking to your baby, and this will also help your baby feel more safe and secure with this new experience and likely to enjoy it a little bit more. Make sure you've got a nice warm towel to wrap your baby in afterwards, and make sure that you get into all the skin folds, so into the neck, under the arms, into the groin, behind the knees, and get all those skin folds dried off so they're not left soggy and damp. Some other common appearances with baby's skin can be dry skin. So dry skin is very common if your baby has gone past their due date. And dry skin in a newborn baby is dead skin and is going to just flake away when the new skin underneath is ready. So it's not like a dermatological condition like eczema that needs moisturising. So just leave it and it will flake away when the new skin's ready underneath. If your baby is born at 36 to 37 weeks, the baby may be covered in some Vernix still. And Vernix is the waxy white substance that our baby is covered top to toe in while they're in utero because they're in that fluid. And as your baby gets nearer their due date, the Vernix starts to kind of wear away. And if your baby's born around term, you may not notice a lot. But 36, 37 weeks, your baby might still have this waxy white substance. A small amount will just rub away as you are handling and clothing your baby, and is best left well alone. If your baby has thick areas of Vernix, so again perhaps in the axilla or in the groin or behind the knees, the midwife will show you how to just gently take a little bit of that thickness away, because a big thick clump of Vernix won't dry out as easily as a thin layer. Erythema toxicum is a newborn rash, and generally at birth babies are born with this beautiful kind of rosebud unblemished skin. And a couple of days after birth they can break out in this slightly blotchy rash, particularly on their cheeks and on their torso. Again, perhaps just the skin acclimatizing to a change in environment. It doesn't require any treatment and will disappear by itself after a couple of days or a week or so. If you think your baby's got a rash that isn't erythema toxicum, then obviously to get some advice and to get that checked out by a healthcare professional. Another common appearance in baby may be having some jaundice. Jaundice in a newborn after the first 24 hours is reasonably normal, and this is to do with the baby's cardiovascular changes happening at birth, and they start to excrete or break down some red blood cells, and the byproduct of this is bilirubin, and this is what causes the colour change with jaundice. Babies that are jaundiced may not appear jaundiced like an adult would, but it might be that you notice your baby is a little bit more highly coloured and it starts to look a bit more red than pink, or it might be that you notice the whites of your baby's eyes are just looking a little bit yellowy. The most important thing for jaundice is that a baby is taking plenty of fluids on board by feeding, and feeding your baby regularly helps the baby excrete this bilirubin. If you are breastfeeding, just to give your baby breast milk, there's no need to offer any formula or any water. If you're formula feeding your baby, then just offer them formula. You don't need to offer water unless it's advised by a healthcare professional. As your baby takes plenty of feeds, the jaundice will resolve. Sometimes the jaundice does cause your baby to be a little bit more sleepy than normal, and your baby might kind of sleep for extended periods of time. So if your baby is looking a little jaundiced, the midwife will encourage you to wake your baby up perhaps every 3 to 4 hours, do some skin to skin, and encourage them to take a few more feeds to help that jaundice resolve. Occasionally the baby's jaundice may be in need of a little bit more treatment than regular feeding, and your baby may need to have a little bit of light therapy, or what we call phototherapy. If the jaundice occurs whilst you're still in hospital and is enough to require some phototherapy, then this is done typically while the baby is in the cot at the side of you on panel ward, and your baby is then either feeding or under the light to help the jaundice resolve. If you happen to have gone home and your baby develops jaundice once you've gone home that requires some phototherapy, then you tend to be admitted back to Woodlands ward, which is our paediatric or children's ward at Harrogate. And then if mum is breastfeeding, then we would encourage mum to be admitted with the baby into a side room, so that you're then able to carry on offering baby the breastfeeds alongside the phototherapy to help the jaundice resolve.